Hello, Water Pioneers Summit. I'm Kate Medlicott. I'm the Sanitation and Wastewater Team Lead at WHO based in Geneva, and I'm really happy to be with you today to share a bit of what we are doing on water and health, water sanitation and hygiene and health at WHO, and some of the emerging issues and challenges we're facing. So let me start by telling you a little bit about WHO for those of you who may not be familiar with us as an organisation. We are the UN specialised agency on health, and we work to protect the most vulnerable around the world, promote health, keep the world safe, and serve the most vulnerable. These are through three specific areas. Firstly, expanding universal health coverage, responding to health emergencies, pandemics, and outbreaks all over the world, and also promoting healthier lives, which is where the water and sanitation work sits. So the things outside the health sector that keep us safe and healthy, living prosperous and happy lives. Over the last 5 years, we have produced this series called the State of the World series on drinking water, sanitation, and hygiene. And if you want to get a quick kind of overview of the state of the issue and what needs to be done about it, you will find it here. I'm going to go into a little bit more detail about these various statistics and activities that WHO is working on now. But let's start with the global health status related to access to water, sanitation, and hygiene. So firstly, water and sanitation is not just about infectious disease, but there are a lot of infectious diseases associated with water and sanitation, as we know, particularly the diarrheal diseases. And you'll find this amazing new set of fact sheets on all of those pathogens at the link you see here, the QR code. But of course, there's also chemical risks, the old ones such as arsenicosis, fluoride that we have been working on for a long time, as well as lots of emerging things, including PFAS and microplastics. I'll come to PFAS a little bit later in the talk. But we know, of course, that water and sanitation is not just about preventing disease, it's about overall well-being. And there are a whole lot of ways that lack of access to water and sanitation affects people's dignity, their access to schooling, the opportunities in the workforce, overall productivity, and especially in healthcare facilities. But when we look at the burden of disease for those outcomes that we're able to measure, we know there's at least 1.5 million deaths per year, and of course, a lot more infections. We're seeing those death numbers come down, but unfortunately, the infection numbers are quite persistent, suggesting we're getting better at curing these diseases, but not necessarily better at preventing them. You can find all the information on the burden of disease in the publication shown here. But when we look at particularly diarrheas, they account for the largest amount of water and sanitation related disease, and particularly right now, cholera is absolutely raging around the world. We're seeing larger and more deadly outbreaks in more countries than ever, and this is largely exacerbated by increasing conflict and climate change. And we know that 80% of what needs to be done to control cholera is basic wash services. That's what we have in most high-income countries, and why we don't have cholera here. Yet we're in a situation where they're in emergency response mode, but with a shortage of vaccines and short-term wash options. So when you look at this image on the side here, we're really on that lower rung of those steps, doing cholera treatment centres, kits, and emergency wash, where we really need to be getting us to those longer term safe water supply and sanitation systems that would prevent cholera more cost effectively in the long run. And of course, we know vector-borne diseases are associated with poorly managed water, and drainage is also on the rise. We're seeing vector-borne diseases threaten more than 80% of the populations of the world, particularly in temperate zones, but those zones are increasing in range. So at least half of the world's population is thought to be at risk of dengue fever. And we're seeing mosquito varieties showing up in different areas, particularly the Anopheles mosquito that's now being found in Africa. So getting now to the aspects of the status of water and sanitation and hygiene, and what is the access around the world? Well, when we look at the targets that have been set for the Sustainable Development Goals for drinking water, sanitation, and hygiene, what you see here is that we need a 3 to 6-fold increase in the rates of progress we've seen between now and 2015. And the good news is we're roughly on track to eliminate open defecation, but for safely managed sanitation services, you can see a big steep incline there that needs to be reached. And frankly, I think it's clear at this point we're not going to reach our SDG targets. And that's particularly because here, when we look at the lowest income countries around the world, those rates of progress are particularly steep and unattainable in a very challenging global environment at the moment. Again, of course, we need a strong enabling environment from national governments to make these changes. So when we look at the status of policy and funding for water and sanitation around the world, we see that 2/3 of countries have quite well developed policies that are under development or under revision. But when we get to the percentage of them, this is the top of the pyramid you're looking at here, that have formally approved policies, that are costed, that have sufficient financial resources and human resources, we see that it becomes very small. So there's a big gap in going from well-intentioned policy through to actually a policy that's backed up with human and financial resources. Okay, so coming now to some of the financing gaps, again, you see here looking at sanitation, drinking water, and hygiene. Water supply typically is the better funded one, but across both rural and urban. Sanitation less so, and particularly rural sanitation is very poorly funded. Hygiene is low, but you would kind of expect that because a lot of the infrastructure costs associated with hygiene falls into the drinking water basket. Moving now to governance, one really strong trend we're seeing coming through the data is that the countries that are on track to meet their SDG targets are more likely to be performing these key regulatory functions. So in this image here, you see a number of typical regulatory functions you would expect to be carried out, for example, setting standards for wastewater and fecal sludge treatment. And the countries that are doing that are making faster progress. And so we see that strong governance, particularly a strong regulator and service providers who are willing to take up the mandate for both sewered and non-sewered services or urban and rural water supply, are making greater progress for their country. Coming now to the health facilities, and it's been said many times by people other than me that, can you even call it a healthcare facility if, in fact, it doesn't have basic water supply and sanitation? These are some regional breakdowns of access to water and sanitation and hygiene in healthcare facilities. And you'll see that some of these numbers are shockingly low. For water supply in the region where you're sitting in, it's quite a good picture. You see 90% of basic water supply and healthcare facilities. But when we go to sub-Saharan Africa for water supply and health facilities, just 50%. These are really shockingly low numbers when you think about doctors and nurses trying to provide hygienic services, healthcare services in conditions where there's no water supply. Similarly, you see very low numbers for basic sanitation and healthcare facilities as well in these regions, and for hygiene. So there's a lot to be done there, and I'll get to that in some of my next slides about this initiative. So yeah, what is WHO doing about all of this? What we've seen just now is a lot of the data we produce to make sure that the evidence is there for what progress is being made or not made. but we also work on the evidence for what works in terms of providing wash services that get the best health bang for your buck, if you like. So I'm going to just cover a number of these quite quickly now. The first is drinking water safety, and the key sort of points of departure in terms of our guidance is the very long established guidelines on drinking water quality and the newer ones that have been done for small community water supplies. These all include risk-based approaches, including water safety planning that's been rolled out in over 90 countries around the world. They also cover some quite specific emerging issues, and particularly things like PFAS, microplastics, and that's increasingly becoming a larger part of our work, not just the preventive risk management through water safety planning, but also assessing these emerging risks and providing health-based guidance on those. When it comes to sanitation, we have a number of core guideline products that underpin the work. The first is the guidelines on sanitation and health, recreational water quality guidelines that you see here, and also ones on safe use of wastewater that are in need of updating. And sometimes I think when people think of sanitation, they think, oh, it's just about getting everybody a toilet. No, of course not. We need to be making sure that that whole chain you see at the bottom here is safely managed from toilet to end use, and that all of those services are working properly so that everybody in the community has coverage. So we're working on community-wide approaches, particularly in partnership with UNICEF and other organisations like WaterAid and the development banks and regulators, which I'll come to. And of course, all of these services are increasingly affected by climate change, whether that's too much or not enough water, or in the case of sanitation, in fact, emissions from those facilities that need to be managed. So we're incorporating climate resilience and mitigation into all of our work. Finally, like WHO is not a big fund like some of the other implementing agencies. So we don't have the bandwidth to do at-scale implementation everywhere, but we do see that regulators are a very strategic entry point for making sure that latest global evidence has been taken up in national policies and plans and laws, regulations, and we work through what we call the RegNet, which is a global network of regulators that allows learning and information exchange between regulators so that we can have a fast track from what is emerging as good practice around the world and through scientific evidence into practice. On hygiene has kind of been the poorer cousin, you could say, in the water and sanitation world, but of course it's absolutely key, and that became very clear during the COVID-19 pandemic. And at that time, we launched the Hand Hygiene for All initiative, which has led to comprehensive country roadmaps in many countries to really make sure that people have the infrastructure and the behaviours to practice hand hygiene in key places, so at home, at school, in the workplace, in healthcare facilities, and so forth. And there's a forthcoming set of guidelines that will be out later this year on hand hygiene and how to maximise uptake of hand hygiene. In fact, it's quite shocking how many people don't wash their hands at key times for various reasons. So while it's perhaps a simple issue, it's one that humans are not particularly good at following through on. Okay, I want to talk now a bit about some of the health sector collaborations we work on. And not all of them, but particularly the Wash and Healthcare Facilities Initiative. These health sector collaborations are places where, well, they're different from what I've been talking about before, because a lot of that happens outside the health sector. This part is really the responsibilities of the health sector, where they need to make sure that water and sanitation is well integrated to get the health outcomes that they're expecting within those programs and services. So the first is the Wash and Healthcare Facilities Initiative. It's a global initiative that provides facilities improvements tools at the facility level, and also working at the national level with things like understanding the situation, working on national coordination and roadmaps, and this global progress tracker you see here, which is covering over 70 countries globally to really try and accelerate that access to water and sanitation. And in fact, waste management and cleaning as well in healthcare facilities. Turning to antimicrobial resistance, of course, firstly, lack of access to water and sanitation means there's a ton of infections that could have been prevented, but are in fact treated with antibiotics, which is a waste of these precious antimicrobials, but also unmanaged waste is a source of emergence and spread of resistance in the environment. So a lack of wastewater and sludge treatment is a driver of AMR. So we work in a quadripartite with FAO, UNEP, and the World Animal Health Organization to try to look at all of these sources of waste to the environment. And specifically, recently, we've put out some very focused documents on wastewater from manufacturing of antibiotics and management of pharmaceuticals. So you can see those there. Neglected tropical diseases is another one. And this is a group of, I think, 21 diseases now that, maybe, many people have not heard of them because they're ancient diseases that affect the poorest and the most marginalized, things like leprosy, soil-transmitted helminths, guinea worm, trachoma, all have been driven down to lower levels, in some cases close to eradication, but nearly all of them have, to sustain that disease reduction, we need to have high quality wash services for the prevention and care of those diseases. So we work with those disease programs to try to firstly focus some of the wash support into those areas, those neglected areas that are still suffering from these diseases, and then also to adjust the programs we needed to make sure that those wash interventions are really breaking the transmission cycle for those diseases, which can be quite specific depending on the disease. Okay, now I wanted to just go a little bit deeper in the time remaining on some emerging issues, and there are a lot, but I've picked 3 here that I think may be interesting for you. So the first is the PFAS, PFOA. I think this has really hit the news a lot recently. People are really concerned about these, forever chemicals, and they're dealt with collectively by our chemical safety team and our drinking water quality team that look at risks from these chemicals from all forms of ingestion, so food and drinking water and other things. And you can see the different programs in which that's embedded. And perhaps you know that PFAS is a chemical that's found in a whole range of household and daily products, including water-resistant clothing, paints, cosmetics, non-stick pans and firefighting foams and so forth. So they're really quite ubiquitous and very persistent in the environment. So what WHO is working on now is firstly a landscaping to review and prioritize the key health effects that we're interested in trying to understand with the evidence from PFAS and the priority chemicals, because there are thousands of them, and working on a methodology to be really clear about how do we derive health-based guidance values, so tolerable daily intakes in both food and drinking water, and then starting on a systematic evaluation for those short list of PFAS compounds as both individual as well as in a mixture form. So from 2025, we'll be employing that methodology for those key parts, and we hope to be having global guidance on these chemicals. Moving to a new topic now, which is wastewater and environmental surveillance, which is something I lead for WHO at headquarters level. I think many of you would have seen this pop up also during COVID. So this saying, oh, what can we find in wastewater, and what can it tell us about the health of the population for specific diseases? And we see that it kind of can answer all sorts of interesting questions, as you see here, along the phase of the outbreak, trying to see, is there a new outbreak in a new area? Is there a kind of early warning of an uptick in disease? Should we be putting restrictions in? Are we finding new variants? Should we be lifting restrictions? All of those things were done during SARS-CoV-2 that was super valuable. So well, here's an example from SARS-CoV-2. So what you see here is a really nice correlation between the wastewater data and the case data, which shows us that wastewater surveillance works. But then now, that clinical testing is dropping off, we're seeing the only source of data is wastewater. So it really shows that it has a really useful public health decision-making added value, which we're now sort of moving more to a multi-pathogen approach for this. So what other things can we look for, and what do they tell us? So we've worked on a pathogen prioritization framework that you see here. And this really starts with, like, what is the public health added value of looking for things in wastewater? Because it is expensive, it is difficult, and we do find that if you look for it, it's there. So we want to be kind of clear, what added value does this provide us in terms of responding to disease? So the framework looks at public health aspects, feasibility aspects, the operational and technical feasibility, acceptability aspects, because there are most certainly ethical issues with doing wastewater surveillance in some circumstances. And then how do we optimize? How do we make sure that we can look for multiple pathogens at once with a single sample, a single sampling site? And how do we make sure that those data flows are well integrated into existing clinical surveillance systems? And we have some pathogen summaries that you can see there for 6 pathogens so far, summarizing what we can do with wastewater surveillance. There's more coming. But what we want to do is really direct those investments using this framework into the places where we know that it's going to add most value in a multi-pathogen way. Okay, my last topic before I close is on climate resilience. So particularly I'm going to talk about sanitation here, but of course this also applies to drinking water systems. What we see, across all system types, that too much or not enough water is a huge risk to the people who first have not received services, and also risk of backsliding for those who already do have services through all of these things here. And also increasingly we're seeing some really strong and quite striking evidence about the level of emissions that are coming from sanitation services that could in fact be reduced. So when we look at the sort of key populations for this, as I alluded to, you can think of all of these people that I showed before that have never had access to basic or safely managed services, that are living in these high impact, high climate risk areas. So this is this part B. So we need to make sure that those people who never got a service in the first place get a climate resilience service. But then we also, in the box C, need to look at the percentage of the population that is living in these high-risk areas that's at risk of backsliding or losing access to services because of these risks that we talked about, whether that's inundation of wastewater treatment plants, of insufficient water for flushing and so forth, or for conveyance of sewers, or too much water that's just causing those very frequent sewer overflows. That means that communities are getting regularly inundated with fecal matter, and of course when that's happening we're not getting the intended health benefits of our sanitation systems. So this is a big plank of what we are doing on climate resilience across the water and sanitation portfolios. But with that, I just wanted to turn quickly to the financing on climate as well, because what you see with the climate financing is that just absolutely tiny percentage of climate financing is going towards sanitation and even to water. Yet when we look in the nationally determined contributions and also the national action plans, it's increasing over the years. We're seeing a greater proportion of them that recognise water and sanitation as an issue. And we're also seeing the Green Climate Fund providing guidance on how to access climate finance for water and sanitation facilities, particularly this new project design guidelines. So I think although it's sort of a low base, there's a big space for us to move into there to try and attract climate financing into water and sanitation services. Okay, I think I'm at my time. Thank you very much for this. I'm not going to attempt to summarize because there's a lot there, but you will find all of these materials at the website link or the QR code here. And with that, I'll say thank you very much and hand back to our facilitators.